This is today's daily NCLEX snack. A parent comes into the clinic with her 4-year-old son who is sick with the flu. Which of the following statements made by the parent would require further education and intervention by the nurse? I gave my child a lemon popsicle this morning for hydration. My son was complaining that his body ached, so I gave him ibuprofen. My son was having severe nausea, so I gave him Pepto-Bismol. I've been giving him acetaminophen every 4 hours for his fever. Pause your screen and write your answer in the comments below. This question ends with the wording, which statement requires further education and intervention by the nurse? So, what are we looking for? We're looking for an incorrect statement made by the parent. Sometimes it feels like we're answering a double negative, which can be confusing. But by identifying the wording used, we know what we are looking for. Another way to say this is which statement by the parent is incorrect. So let's review the options. I gave my child a lemon popsicle this morning for hydration. Popsicles, water, fluids, and gelatin desserts are great ways to hydrate children with the flu who are at risk for becoming dehydrated. This statement does not need further education or intervention. My son was complaining that his body ached, so I gave him ibuprofen. This is the proper use of ibuprofen. This does not need further education or intervention. My son was having severe nausea, so I gave him Pepto-Bismol. You should not give a child salicylates products, especially when they have the flu. The trade name for Pepto-Bismol is bismuth subsalicate, which is a salicate product. This increases the risk for developing Reye's syndrome, which causes brain and liver damage to children with recent viral infections. We should be feeling confident that this will be our choice since the statement needs to be addressed by the nurse. But we always want to read each choice. So let's see choice D. I've been giving him acetaminophen every 4 hours for his fever. This is the proper use of acetaminophen. This statement does not need further education or intervention. At this point, we can circle back and confidently decide that answer C is the correct answer because it needs intervention and the parent requires further teaching since their statement was incorrect. And let's talk a little bit more about what Reye's syndrome is. Reye's syndrome is a dangerous diagnosis in young children, and it develops from the ingestion of aspirin products or salicylates, especially after a recent viral infection. So think, salicylate products plus viral illness in children equals Reye's syndrome. It can cause issues with the brain such as encephalopathy or cerebral edema, and issues with the liver such as acute fatty liver failure. You want to educate parents on salicylate-containing products. These are aspirin, Alka-Seltzer, Pepto-Bismol, and kaopectate. All these should be avoided in children, especially with a recent viral illness. That's all for your daily NCLEX snack. If you want more NCLEX style practice questions like this, you can sign up for the free daily NCLEX snack. This is where you get an email every morning with an NCLEX style question and a comprehensive review. And it's free. The link to sign up is in my bio. Happy studying, future nurses.